Assalamu alaikum and good morning to one and all. Today we'll study about part 1 of purgative, anti-diarrheal and antispasmodic drug. At the end of this e-learning session, you are able to define and classify purgative drugs, discuss its mechanism of action and pharmacology. So let's start with the definition of purgative drugs. So the purgatives, these are the drugs which used to promote evacuation of the feces from the bowel. So this is very important, that is, this is the category of the drug which help in evacuation of the feces and especially from the bowel. So what happen in case of the constipation? In constipation, the stool become hard and it's stuck in your large intestine. Okay, so due to the hard stool, it's stuck in the large intestine, and due to this condition, the patient suffer from very severe discomfort and abdominal pain because he is not able to defecate as the stool become hard and it is stuck in the intestine. So there are different reasons for this. For example, in case of elderly patient, there is a decrease in the peristaltic movement of your large intestine, and due to decrease in peristaltic movement, there is no proper movement of the fecal matter from from one part of the intestine to the other part of the intestine, isn't it? So due to this also the patient suffer from the constipation. So if this is the case, then to avoid this discomfort and to stimulate the process of the defecation, or to start the process of the defecation, or that is also called as the natural call, you can give the purgative drug. So what purgative drug will do? These purgative drug, by their way of different mechanism, they help in evacuation of the feces from the bowel. So depending upon their intensity of the action or the purgative, they have the different synonyms. So the term apparent, laxative, purgative, and drastic cathartics are used to describe the magnitude of the purgative action. So what it means, when you go from the apparent to the drastic cathartics, the intensity of the purgative action, it is increased. For example, in case of the laxative, the purgative action, it is more as compared to the apparent. Likewise, in case of purgative, their purgative action, it is much more as compared to the laxative. Whereas the drastic cathartics, these are the drug, or these are the purgative. Basically all are the purgative. So these are the purgative which having a very high intensity of the purgative action. So depending upon the patient condition, you can use different types of purgative drug. For example, if patient is suffering from the mild constipation, then in such case you can use the apparent or laxative drug. Likewise, if he is suffering from the mild to persistent constipation, you can use the purgative drug. If he is suffering from very severe constipation, when you are giving the apparent drug, laxative or purgative, it doesn't work, then in those cases only you should go for the drastic cathartics. Or suppose if you have selected drastic cathartic at first stage, then it may lead to the diarrhea to the patient. So to avoid that, depending upon the patient condition, whether it is the mild, moderate or severe, you can select different types of purgative drug, either apparent, laxative, purgative or drastic cathartics drugs. Okay, so this is all about the introduction to the purgative drugs. So when we are using these drugs, so as I have mentioned, so they are used in the treatment of the constipation when patient is unable to defecate naturally, or he is not getting natural call maybe from 2 days or 3 days, and it may lead to the discomfort to the patient suffering from the abdominal pain. So this is the indication that now the patient should be given with the purgative drug. So it is generally used for the treatment of the constipation. In addition, it is mostly used especially in case of elderly patient, because in elderly patient what happened, their natural intestinal motility it is decreased. Since natural intestinal motility it is decreased, the fecal matter which is formed especially in case of your large intestine, it not propel from one part to the other part, or it is not going forward, isn't it? So to enhance that, generally the elderly patient, they regularly take the purgative drug. So it is one of the much abused drug which is used by the elderly. So when you call any drug as an abused drug, so suppose if the patient is addicted to the drug or without taking the medicine, if he is unable to have the natural call, it means he has the addiction to the purgative drug. Then in such case, you need to have or you need to switch over to some other purgative drug so that that addiction can be avoided. Okay, and why it is happening? Because in elderly patients, since they are regularly taking this medicine, so they become habituated to the daily dose of the purgative, and it lead to the drug abuse, especially in case of elderly patient. So although elderly patient they need the purgative, so in order to avoid habituation or addiction to the drug, what you can do, you keep on switching over to the different category of the drug. Instead of giving same drug for long period, you can use different category of the purgative drug that we will see in detail in the classification of the purgative drugs. Okay, so let's go to the classification of purgative drugs. So purgative drug, they are basically classified into three broad categories, and again there is sub classification under each category. So the first broad category, it is the bulk purgative. So name itself indicate that what bulk purgatives they are doing, they basically increases the bulk of your intestine. And we know when there is increase in bulk of the intestine, it gives the stimulus for the defecation. Right? So those purgative drugs, they are called as bulk purgative. But again, this bulk purgative, depending upon their type, they are having different mechanism of action. For example, first subclass of bulk purgative, it is osmotic purgative. Example, magnesium hydroxide, magnesium sulfate. Easy to remember, just we have changed one ion, that is hydroxide here. So instead of hydroxide, here you have added just sulfate. So it becomes magnesium sulfate. Then sodium potassium tartarate. When you take the magnesium hydroxide, magnesium sulfate, what these drugs are doing, they attract more water. And when water it is attracted in the GIT, what will happen? It will lead to the softening of the stool, or sometime it will lead to the worst. So we'll see this in a detail. Second subcategory, it is hydrophilic colloid. So difference is only is that hydrophilic means these are water loving. So they attract more water. So example of such drugs are the agar, psyllium, methyl cellulose. So these are hydrophilic colloids since they are water loving, and also they, when they attract the water, they increases the bulk of the intestine. So since overall result it is increase in a bulk of the intestine, they come under bulk purgative. Third category, it is vegetative fiber like the bran, isabgula husk. So these purgative, they are having the ability to form mucilaginous mass when it's come in contact with the water, and since they form the gel or the mucilage, it increases the bulk of the intestine and it may lead to the purgative action. So this is the first category, that is the bulk purgative, which is subclassified as osmotic purgative, hydrophilic colloids and vegetative fibers. Second broad category, it is irritant purgative. So the irritant purgative, what they are doing, they basically produces the irritation in the intestine, and due to irritation, it increases the intestinal motility. We'll see detailed mechanism in next slide. Okay. So before that, let's see the sub-classification. So based on the type or the chemical property of irritant purgative, they are classified as anthraquinone purgative, and drugs belong to this category are the rhubarb. Then we can use the senna leaf, cascara, and the even your aloe, or it is also called as the aloe vera. So these are all anthraquinone purgative because they are having common structure which is belong to the category of anthraquinone glycoside. Okay, so these are all irritant purgative. Then second subcategory, it is the castor oil. So castor oil, it is well known irritant purgative. Phenolphthalein, so you are using in analytical lab for as an indicator, but phenolphthalein do also having irritant action on the intestine and it produces the purgative action. Then bisacodyl, and lastly the sodium picosulfate, it also produces irritant action on the intestine and it has the purgative action. Third, it is lubricant purgative. So the lubricant purgative, it means what drugs are doing, So lubricant action, it means it is the slippery action. For example, when you are coming in contact with the oil, so how when you touch to the oil, what is your feeling? You get the slippery action. So the lubricant purgative, they provide the lubrication, means slippery action to the fecal content, and due to this slippery action, or when the lubricant come in contact with the stool or the fecal content, which is very hard in nature, so what they are doing, first they provide the lubrication, so that is slippery action, and secondly, when they are coming in contact with the stool, they also soften the stool, and due to softening of the stool or the fecal content, it provides the purgative action. So the example, it is the liquid paraffin, then dioctyl sodium sulfosuccinate, glycerin suppositories, and soap water enema. So these are all having the lubricant action, which is responsible to produce purgative action on your GI tract. So in next slide, we'll see the mechanism of action of these three class of purgative drug. So let's start with the first, that is the bulk purgative. So as I have already mentioned, what bulk purgative they does, they increases the bulk of the intestine. Okay, so they increases the bulk of the intestinal content, and due to increase in a bulk of intestinal content, it is the natural process. Whenever there is more bulky intestine, then this bulky intestine, what it does, it stimulate your CNS, and it stimulate the CNS to enhance the peristaltic movement. So there is overall response is it promotes the peristalsis, and if peristalsis it is promoted, what will happen due to promotion of the peristalsis? It will enhance the process of the defecation. So the mechanism, it is through the increase in the bulk of the intestinal content. So this is the overall mechanism of bulk purgative. But in classification, we have seen there are different subclasses are there, like osmotic purgative, then hydrophilic purgative. So we'll see the detailed mechanism of each subclass when we study that particular drug belong to that particular class. Okay, so I hope it is clear the mechanism of the first class of the purgative, that is the bulk purgative. Now let's go to the second class, that is the osmotic purgative and saline purgative. So what these purgatives are doing, on ingestion they minimally absorb from the intestine and they retain the water. Since they are not absorbed into the intestine, so what will happen, they remains only in the intestine, and as they having the osmotic action, due to their osmotic action they will retain the water, and once water it is retained, wherever these osmotic purgatives are going, what they will be doing due to that, so due to the retention of the water, your stool become a soft, and we have seen one of the reason for the constipation, it is the hard stool, or the stool with less amount of the water. So due to retention of the water, your stool become a soft or even fluidy in nature. So when consistency it is changed from solid to the liquid or fluidy in nature, it will easily stimulate the process of the defecation. So this is how osmotic purgative, or they are also called as saline purgative, they produces the purgative action in patients suffering from the constipation. So this is about osmotic purgative. Second class, it is the irritant purgative. So very interesting action, irritant purgative they has. So what they are doing, they produces the irritation of the intestine, and due to irritation of the intestine, there is stimulation of obage plexus in the bowel wall. So what this obage plexus is, basically the obage plexus, it is the group of the neuron which are responsible for enhancing peristaltic movement. So if this obage plexus it is not stimulated, or if there is no stimulus to the obage plexus, there will be no enhancement of the peristaltic movement. Since these irritant purgative, due to their irritation or their irritant action on the intestine, they stimulate the obage plexus in the bowel wall, and now due to stimulation of the obage plexus, it will promote the peristalsis, and once peristalsis it is promoted, the patient will have the defecation. So it will stimulate the defecation or help patient to defecate due to stimulation of the peristaltic movement. Okay, so this is how the irritant purgative works. So in irritant purgative, whenever you are explaining the mechanism, one word it is very important, that is the stimulation of obage plexus. So you must write that before explaining their mechanism of action. Okay. So this is the second category. Let's see the mechanism of action for the third category, that is the lubricant purgative. So the lubricant purgative, what they are doing, they lubricate. What do you mean by lubrication? So the lubrication, it is basically the slippery action. So it will help to move your stool from one place to the another place. And since most of these lubricant purgative, they are liquid in nature. Since they are liquid in nature, they will help to soft the stool. So lubricant purgative works by two mechanisms. First one, it is a lubrication, and since they are liquid in nature, what they are doing, they make the stool consistency soft. So instead of solid, it becomes a semi-solid, right? So due to both the action, that is lubrication and softening of the stool, the fecal matter in the colon and the rectum will be moving forward, and it will lead to the defecation in the patient. So this is how all three categories of purgative drugs, they produces the defecation or pharmacological action in the patient. Okay. Now let's see one by one or the each purgative in the detail. So first purgative, it is the bulk purgative. Now among the category of the bulk purgative, the subclass, it is the osmotic purgative, and that is also called as the saline purgative. So we'll see a few drugs from each category as far as your exam is concerned, and you will also get the understanding about their pharmacological action and their mechanism of action. Okay, so the first drug belong to the category of the osmotic purgative. It is the saline purgative. So it is the example, it is the magnesium sulfate. The magnesium sulfate, it is also called as a Epsom salt. So it is well known by the name called as the Epsom salt. So it is the potent osmotic purgative. Why it is potent osmotic purgative? Because it having two important ion. One, it is the magnesium, and second one, it is the sulfate. And both these ion, that is magnesium and sulfate ion, since they are having osmotic purgative action, so they produces very good defecation in the patient. So they minimally absorbed by the small intestine. So when you administered magnesium sulfate, if they are absorbed into systemic circulation, then they will attract less amount of the water. Since they are having minimum absorption into the small intestine, due to this minimum absorption into the small intestine, whatever drug it is administered to the patient, these drugs remains in intestine itself, right? And 100% of this drug will attract the water, and due to attraction of the water, it helps to change the consistency of the stool from hard to the soft, or from solid to the semi-solid, or from semi-solid to the liquid, and which enhance the process of the defecation. So this is how magnesium sulfate work. So both magnesium and sulfate ion, they are potent osmotic purgative nature, which minimally absorb into the small intestine, and it attract more and more water in the intestine. Second, which is the sweet syrup. So you are adding some amount of the sugar so that you can mask their bitter taste, and the patient can comfortably take the dose of the magnesium sulfate. So this is the problem with the magnesium sulfate, but at the same time, both small as well as large intestine. So you need the drug or the which having the high intensity of purgative action to remove the stool from the both small as well as large intestine. So the drug of choice, it is the magnesium sulfate, because it can provide almost complete evacuation of the stool from both small as well as large intestine. Okay, so this is about the pharmacology of the magnesium sulfate. Next osmotic purgative is the magnesium hydroxide. So magnesium hydroxide, it is also called as the milk of magnesia, and the milk of magnesia or magnesium hydroxide, it is generally act as an antacid. So it is used as antacid. It is present in many the liquid antacid formulation in the form of the syrup, but it having the additional advantage is that, so generally when you are giving the antacid in the form of the tablet or other category of the antacid, like those which block your histaminergic receptor like ranitidine or cimetidine, so all these antacid drug, they having tendency to produce the constipation. So if antacid itself produces the constipation, so patient is already in discomfort due to hyperacidity, and that is why he is taking the antacid, right? And if he also having the constipation which is induced by antacid itself, then it will further enhance the discomfort to the patient. So in such patient who having the tendency to produce the constipation, when they are treated with the antacid, then instead of giving the drug which can block histaminergic receptor to having antacid action, or maybe you are giving the omeprazole to having the antacid action or to reduce secretion of the acid, and if they are producing the constipation, then instead of using those drugs you can use the magnesium hydroxide, because it provides the dual advantage. It acts as an antacid and also it reduces tendency to produce the constipation by other antacids. So depending upon the patient's situation, the physician, it is the right person to judge and prescribe the medicine which is best suited for that particular patient, right? So if you are using magnesium hydroxide in those patients who have a tendency to produce constipation by other antacid, then in such case you need to use the dose of 10 ml. So the dose, it is very important, because if you take the less dose, then it may not produce that particular pharmacological action. So you must remember their pharmacological action, how it works, when to use those medicine, and what dose it is to be given, treatment of the constipation, and the use of different purgative drug. Okay, so we have seen about the magnesium hydroxide. Now we'll move to the second subclass, that is hydrophilic colloid. So belong to the class of first subclass, that is osmotic purgative. We have seen the magnesium sulfate and we have seen the milk of magnesia. Now we are moving to the hydrophilic colloid. So example, it is the methyl cellulose. So methyl cellulose, it is very good hydrophilic colloid, and name itself indicate that what this drug will be doing. These drugs, they are hydrophilic in nature, means they are water loving. So they will again attract more water due to their hydrophilic action. Okay, so as far as their chemistry is concerned, so methyl cellulose, it is partially polymerized form of the cellulose. It is basically cellulose, but when you partially depolymerize the cellulose, it will give you a methyl cellulose. Okay, so it is not absorbed in the intestine. So that is what you need. You remember that most in case of bulk purgative, then in case of the irritant purgative, or in case of the lubricant purgative, it is better drug should not absorb into systemic circulation, because moment drug absorb into systemic circulation, it won't produces the local action. So this is the one thing. Second thing is that when it is going into systemic circulation, it may produce as the systemic side effect. Okay, so ideal purgative drug having minimum absorption into systemic circulation and having more local action on the intestine. So you must remember this point as a pharmacist. Okay, so the methyl cellulose, what it is doing, it is not absorbed into the intestine. It absorbs water because it is hydrophilic in nature. After absorption of the water, it swell to form the gel. So now due to the swelling, because it is now the methyl cellulose, after the swelling, it form the gel. Due to the formation of this gel, it increases the fecal bulk, and when we know when there is increase in the fecal bulk, what happen? It will enhance the peristaltic movement and it lead to the defecation in the patient. But to have this action, the very important precaution is that it should be taken with substantial volume of water. Now why it should be taken with substantial volume of water? Because in order to swell and form the gel and increase the fecal bulk, it need water. Suppose you have not taken along with substantial volume of water, then instead of having purgative action, it may lead to more constipation, because it will withdraw water from existing stool. So stool become more hard, and due to hardening of the stool, it will lead to more and more constipation. So same drug, that is hydrophilic colloid, when you are taking with substantial volume of water, it will produces the purgative action. Okay, so you will get purgative action when you are taking along with the substantial volume of the water. But suppose if you are not taken with the water, then instead of purgative action, it will produces the constipation. Okay, so do remember that this is the drug that is used in both the case, in case of constipation and also in case of the diarrhea. right? So when you are using in case of constipation, you have to take along with substantial volume of water. When you are using in case of the diarrhea, you should take less amount of the water so that it can absorb water from the stool, isn't it? So this is how same drug produces both action, purgative as well as anti-diarrheal action. So we'll see this drug in anti-diarrheal part of this chapter also. Okay, so it should be taken with substantial volume of water. Dose it is 1 to 3 grams. So this is very important. Next drug, it is the hydrophilic colloid. So that is same category, but drug is different. That is the psyllium seed. So psyllium seed, it is basically dry ripe seed of plantago psyllium that contain lot of mucilage. So since it contained a lot of mucilage, when it's come in contact with the water, what it does, it imbibe about 20 times its weight of the water. It means their volume, suppose if volume it is just 1 ml, when it absorbs the 20 ml of water, now this 1 ml of the volume will be converted into the 20 ml, right? So since it imbibe 20 times its weight of the water, it will lead to the swelling or it becomes swell in the bowel, and since it swell in the bowel, it will stimulate the peristaltis, so there is increase in the peristaltic movement. Also it form a soft and bulky mucilaginous mass. So overall result is there is increase in peristalsis movement, and it will lead to softening of the stool, which help in the process of the defecation, right? So the dose we are using, it is the 5 to 15 gram. So when we are using hydrophilic colloid, the dose must be 5 to 15 gram. Again, it should be taken with substantial volume of the water, because here water is very important. If water is not present in the intestine, then instead of purgative action, the same drug, it may further complicate the constipation, and it may lead to more discomfort to the patient. So in case of both hydrophilic colloid, you must remember that you have to take this drug with substantial volume of the water. Then last category, that is vegetable fibers. So this is the last category, belong to the category of the bulk purgative. So these are basically the fibers which are derived from the vegetable. Since they are derived from the vegetable, they are called as vegetable fiber. So well-known vegetable fiber, it is Ispagula husk. So it is also called in the local language, you may have heard your parents are using, you call it as the isabgol husk or isabgol powder. Okay, so basically it is the Ispagula husk. So it is obtained from Indian plantago, so that is the biological source. It having the same property as the psyllium. What is the property of the psyllium? It imbibe about 20 times of its weight of the water, and it converted into mucilaginous mass, which produces the peristaltic movement, and it helps in softening of the stool. So it having this almost same property as the psyllium, and it is used as a bulk purgative, especially in the treatment of the chronic constipation. Because in case of chronic constipation, if you take other category of the drug like the irritant purgative, then if due to regular irritation of your intestine, it may lead to some damage to the neuron. So in such case, you can use the vegetative fibers, since they are belong to the herbal source or the vegetable. They also having less side effect. Since in chronic constipation you have to almost daily take the medicine, so you must select the drug which having least side effect. Okay, so you are selecting the vegetable fibers. So it is generally used for the treatment of the chronic constipation. So dose use, it is 3 to 5 gram. Okay, so I have done with my today's session. So to summarize, very important thing in bulk purgative, that you must remember that it must be taken with plenty of the water. If you are not taking along with the water, instead of purgative action, it may produces further constipation, or it may further complicate the constipation. So we'll be seeing this drug in anti-diarrheal chapter also, but there you are taking this drug with less amount of the water, or almost you are just eating it like the dry form, so that it can go in the intestine and it absorb water from the stomach instead of adding water in your intestine. Okay, so this is how this bulk purgative works. So I have done with my today's session. Thanks for watching my session. If you like this session, then do remember to give me a thumbs up. Also subscribe to my channel for more such learning.